with Megan McCarver. She is an excellent yoga teacher and yoga therapist, and we've been working together to create this for you in the hopes that it helps. Megan has osteoarthritis of her right hip, which has been causing some joint locking, and specifically in the direction of flexion, so drawing the thigh in towards the chest, it will occasionally lock. But we've been working together and she's getting better, so we are happy to share this, her sequence for stabilizing this right hip, and we hope that it helps you as well. So,
thank you, Dr. Jessie.
Oh, of course, thank you. Thank you. So we're going to base all of this sequence off of Dandasana. So Megan is seated in Dandasana, and the first thing that she's going to do is just create some length in her body. So she's going to take her arms up on inhale breath, just lengthening up through the torso, stretching out, and then exhale, bringing the arms down. And again, she'll do that again, switching the thumb or finger that's on top. Big breath in, lengthening up through the spine, grounding in her sitting bones, and then exhaling out. The next thing we want to do is just create some nice fluid motion in the hip joint. So we windshield wiper the feet back and forth. And you want this to be nice and fluid. So we're pumping the synovial fluid of this hip capsule as she's doing this. It feels nice too, right?
Oh, it's wonderful.
So from here, she's going to find Dandasana or staff pose, which is really going to isolate the hip flexors, but we have a nice solid base for the pelvis. So in this position, she has a beautiful Dandasana, and she's going to start to contract the right thigh, and she's getting stronger, so she can almost get a little lift to the heel, but you don't even have to worry about getting your heel off the ground. You're just contracting the top of this thigh and getting a little, almost the thought of a lift of the hip. Now she's improving, so she's able to get the leg off the ground. So we'll do 10 sets of these. And how many are you doing now? Are you up to like 15 or?
9. I still do 10. 3 sets of 10.
3 sets of 10. And then in between, windshield wiper again. And this is just an opportunity. These are pretty difficult, so this is just an opportunity to loosen everything up. And then from here, we will start the crossovers. So nice lift of the leg up. She's also pulling from her abdomen. She brings it across, brings it back, and then presses it down to the ground. So she's using her thigh and her hip flexor, strengthening this capsule in the hip, but she's also pulling from her belly. She's got great strength, core strength and stability. So this is looking really nice. And take your time with these. Nice, just little lift. Don't worry if you don't get the leg up quite as high as this.
Dr. Jessie, I do 3 sets of 5 there.
3 sets of 5. Okay, perfect. Yeah, 5 is plenty.
Steady,
okay.
steady, steady, and slow.
That is great, and we love this little in-between too. So the last one that we want to share with you is the hamstring drag. So from this position, so stable in the pelvis, that's why I love this, she's going to bend her right knee and then push down into the heel and drag the leg up. So as you do this and you're pulling the leg out, you're going really high. It's really nice. Good.
Thank you.
And then slide it back down. She's getting a nice activation of that hamstring because she's actively pushing the heel into the ground. So anything that we can do to stabilize this femur bone in the socket is also benefiting her hip and the flexion. So look at that beautiful hip flexion. So,
and you'll find as you do these exercises, you'll just love them because they'll give you your freedom in your body, in your mind, and in your heart.
They make you feel strong. You're sitting upright, and they really build a lot of strength. I've started doing these myself too. So after we do 10 on each side. Or
about 8.
8, and we do 3 sets of 8. So of course there's some wiggle room with these, with the counts of these. So after she's completed that, then she'll do another set of the little soft windshield wipers. Everything's kind of loose. in that position. And then we've added a twist into the sequence. So she's going to draw her right leg in towards the chest. And it's not so much about compression. We don't want compression of the hip, but it's just a nice way of lining up the femur into the socket to prevent the locking. And then she's going to take her right arm back behind her and really grow tall through the spine and push down through her sitting bones. And she's just getting some nice sensation in that outer right hip. Minimal sensation in the groin and the front of the hip, but it just feels nice to improve this range of motion, to really feel that in your body again. Feels really good. So thank you so much for watching, and we really hope that this can help you. And thank you, Megan.
Thank you, Dr. Jessie.
Namaste.